Sohana here. In this video, we will explore more about robotic surgery and I will explain with my partner, which is Nur Aina Syahira Sakina. So, are you guys excited? Of course, yes, right. So, let's go!
Okay, so first thing first, of course you want to know what is robotic surgery. Robotic surgery are types of surgical procedures that are done using robotic system instead of human, so it's really easy. Robotically assisted surgery was developed to try to overcome the limitations of pre-existing minimally invasive surgical procedures and to enhance the capabilities of surgeons performing open surgery. So what I can say here is robotic surgery is really convenient and easy for the surgeons to make surgical procedures. Robotic surgical system is really a system that allows your surgeon to make precise, delicate motions while controlling the machine. So in order the surgeon to use the robotic system, the surgeon makes tiny incisions in the body and insert miniaturized instrument and a high-definition 3-dimension camera. And sometimes skin incisions are not required at all. Okay, to make it short, you just have to think that robotic system is like a video game. When you play a video game, you move a control button and the machine translates your movement into real time by making your moves precisely on the screen. So during a robotic system procedure, your surgeon uses master control to manipulate the instruments, and the instruments translate your surgeon's movement into precise movements inside your body. Okay, next we go to history of robotic surgery. So, the first robotic surgery was introduced in 1985 when the Puma 560 robotic surgical arm was used in a delicate neurosurgical biopsy and a non-laparoscopic surgery. The robotic system allowed for a successful robotic surgery and the potential for greater precision when used in minimally invasive surgeries such as laparoscopies, which typically utilize flexible fiber optic cameras. Next, the robotic system kept on progressing when the first laparoscopic procedure involving a robotic system, which is a cholecystectomy, in 1987. So the following year, the same Puma system was used to perform a robotic surgery transurethral resection. In 1919, the ASOP system produced by Computer Motion became the first system approved by the Food and Drug Administration (FDA) for its endoscopic surgical procedure. Next, in 2000, Da Vinci surgery system. I think this is the biggest achievement in surgery system. The Da Vinci surgery system becoming the first robotic surgery system approved by the FDA for general laparoscopic surgery. This was the first time the FDA approved all-encompassing system of surgical instruments and camera or scopic utensils. The Da Vinci robotic surgery system, which is 3-dimensional magnification screen, allows the surgeon to view the operative area with the clarity of high resolution. As a result, further innovations and improvements were centered on the Da Vinci platform, which has subsequently dominated the world of robotic surgery for almost a decade. For example, Long-distance surgery where a doctor could operate on a patient in another city, state, or even a different continent. Okay, next we go to the revolution of robotic system. The first robotic system was in 1985, which is a non-laparoscopic surgery. Next, in 1987, a robotic system, a cholecystectomy, was produced, while in 1990, a soap system produced by computer motion. And the last one is the Da Vinci surgery system in 2000.
The Da Vinci surgical system is the most advanced platform for minimally invasive surgery available in the world today. The integration of high-resolution 3D vision, wristed instruments, and intuitive motion control enable the Da Vinci surgeon to transcend the limitations of conventional surgical technologies. Three network components comprise the Da Vinci surgical system: an ergonomic surgeon's console, a patient-side cart with 4 interactive robotic arms, and a high-definition 3D vision system. Seated at the console, the Da Vinci surgeon views a remarkably clear 3D image of the surgical field. The system scales, filters, and translates the movements of the surgeon's hands on the master controllers to 4 interactive robotic arms on the patient cart. The precisely controlled micro-movements of the Da Vinci instruments are enabled by the computer processors of the system. These dedicated processors perform millions of safety checks over the course of a procedure for enhanced surgical precision and control. Da Vinci EndoWrist instruments are designed with a unique wristed architecture that provides 7 degrees of freedom for a range of motion greater than even the human wrist. This proprietary design enables surgical maneuvers impossible with conventional laparoscopic tools. The system requires that every surgical maneuver is under the direct control of the surgeon. Redundant safety checks prevent autonomous movement of the instruments or the robotic arms. The Da Vinci S surgical system moves surgery forward with a new level of technical capability that enables minimally invasive surgery in complex procedures as never before. Da Vinci provides a streamlined surgical experience that benefits the hospital, the surgeon, the OR team, and, most importantly,
as you go through the robotic surgery, of course, you want to know the example of robotic surgery. Firstly, robotic gynecologic surgery. This surgery includes smaller incisions that may result in less post-operative pain. But if we compare with open surgery, a large incision is made in the abdomen and it can cause significant pain, physical trauma, and a long recovery process. Another example is robotic prostate surgery. Studies indicate that one of the most effective treatments for prostate cancer is radical prostatectomy. The potential advantage of laparoscopic and robotic-assisted laparoscopic prostatectomy over conventional open surgery include smaller incisions that may result in less post-operative pain. Okay guys, so for the third one is robotic kidney surgery. Many kidney surgeries have required removal of the entire kidney, called a radical nephrectomy, which is an open procedure that requires a 6 to 8 inch incision. But in Da Vinci surgical system, it's only required small incision. Because of the precision of this type of laparoscopic surgery, kidney patients now have a laparoscopy option both for radical and partial nephrectomy. For the last example, this is very familiar surgery this day, which is total knee replacement. During a complete knee replacement, the surgeon addresses all three components of the knee. This intervention is often best for people who have severe arthritis, deformities, or issues with improper alignment. When orthopedic specialists perform orthopedic surgeries with robots, they typically use an arm to shape the surrounding bone. Then, they insert an implant that replaces the affected part of the knee.
Hi, I am Aina Shahira. Now, let us explore more about robotic surgeries.
Before agreeing to any surgery, we must know the benefits and the risks for all available treatment options. Now, let us take a look at pros and cons of robotic surgery. Number 1. It gives less trauma for patients, which is very helpful since it gives smaller incisions that can cause less invasive. As a result, patients experience less pains, less blood loss, giving a smaller scar and have a faster recovery time. As for example, liver resection would keep a patient hospital-bound for a week or more after a traditional procedure. However, by using a robot, it can reduce that hospital stay to just 1 or 2 days. Number 2. It provides surgeons with better accuracy, flexibility, and controls. Some surgeries, from orthopedic operation to neurological procedure, require a high degree of accuracy. One mistake in procedure can cause damage or even result in the death of patient. Robotic surgery are susceptible to the shaking or other strain-related movements human surgeons might experience. If the controller's hands are shaking, the machine software compensates for that movement so it doesn't affect the surgery. Each robotic hand can rotate about 360 degrees multiple times, something that humans cannot do. This increases the range of motions. This is an improvement over traditional laparoscopic stools, which are straight and unable to bend, so they are harder to manipulate. It is also equipped with a 3D high-definition camera, which providing a better view of the surgical site. Number 3. It can reduce the surgeon fatigue and ergonomic positioning. Surgeries usually take multiple hours, which are exhausting for surgeons. However, by having a surgery robot, it allows the surgeon to sit comfortably while operating. This could help keep surgeons fresh and aware for the duration of their surgeries, preventing fatigue-related errors and reducing the potential for medical malpractice. We must know that having the surgery needs to be paid at higher costs and even higher when related to robotic surgery. This is because the high cost of installing a robotic surgery system can increase the cost of surgical procedure. Surgical robots are costly to maintain and their operations requires additional training, which is also expensive. Movement latency will take time for a robot to carry out the surgeon's command, so it will be quiet to perform robotic surgery in this case. The other cons of robotic surgery is robotic surgery might have a longer set times. This is because it has a difficult access to patients. There are some risks that are related to robotic surgeries. The first one is the failure of robotic system. Although mechanical failures and malfunctions during surgery are rare, they are possible. They can lead to a number of complications such as sparks, electric arcing, and burns that may cause tissue damage. Also, there is a risk of nerve palsies due to direct nerve compression by the robotic arm. The second one is human error. Human error while operating the robotic technology is another risk. However, with proper training and experience, this risk can be better managed. Our surgeons must be professionally trained to use an alternative type of surgical method, such as laparoscopy or open surgery. Switching to another type of surgery means even longer procedure time and longer anesthesia time for the patients. Sometimes we need to make a larger incisions as well, and in this case, the recovery time will be extended too. In line with technological advance with many kind of aspects, there is also advancement in medical technology where the robotic surgery is assisted. It was introduced and been modified in order to be more effective in safety and also can enhance the development in medicine. Robotic surgery provides convenience for society, especially for surgeons and patients. It is really important for social welfare. Despite the higher cost, actually it's totally worth it.